What's up, everybody? Welcome to the next episode and the concluding part of Let's Talk ADHD. I'm Sachima, and we're just going to conclude and wrap up. Stay tuned. So last time we talked about what ADHD is and how it's diagnosed using the symptoms. Now I want to point out that there are some healthy children that can be inattentive, they can be hyperactive or impulsive at one time or another in their lives. It's usually a norm for preschoolers to have like short attention spans, and sometimes they're unable to stick to one activity for a very long time. Even in older children and teenagers, sometimes your attention span often depends on the level of interest of the activity. Even for hyperactivity, there are some children that are naturally energetic. So children should never be classified as having ADHD just because they're different and they can't pay attention or you say they're hyper. This is why you should go to the doctor to get a correct diagnosis. Okay? So today we're going to talk about the etiology, which means causes, and also the management and treatment of ADHD. So there's really no known cause of ADHD. Research is still ongoing, but there are several risk factors that can be involved. Risk factors like genetics, the environment, problems with the central nervous system, brain injury. It could be hereditary, meaning blood relatives such as a parent or a sibling that has ADHD. So what this means is that it runs in the family. Another risk factor could be exposure to environmental toxins such as lead that you commonly see on paint in pipes of older buildings. Another risk factor is when the mother uses drugs like alcohol, if she smokes cigarette during pregnancy, when you have low birth weight, premature birth babies. So that's risk factors. Now, some of these risk factors can be prevented to reduce the child's risk of getting ADHD. So things like during pregnancy, avoid anything that could harm the development of the baby. For example, don't drink alcohol, don't use recreational drugs, don't smoke cigarettes. Protect your child from exposure to bad toxins like cigarette smoke and lead paint. Limit screen time. Although this is unproven, it may be important for children to avoid excessive exposure to TV and video games in the first 5 years of their lives. There's also a belief that ADHD is caused by eating too much sugar. I'm sure you've heard of that belief, but there's no research done to prove this. So far, now, this is just a myth, okay? All right, let's move on. We're going to talk about the treatment of ADHD. ADHD is chronic and it needs to be managed. The treatment won't cure it, but you can help with the symptoms. So the treatment typically involves medication and behavioral intervention. Early diagnosis and treatment can make a very huge difference in the outcome. So according to the American Academy of Pediatrics, AAP, it's recommended that children younger than 6 years old should have behavioral therapy first before medication is tried. And then for children over 6 years of age, the recommendation include medication and behavioral therapy together. So schools can also be part of treatment as well. The goal of behavioral therapy is to learn or strengthen the positive behaviors and remove the unwanted or the behaviors that cause a problem. Medications can help manage symptoms and help them control difficult behavior. So the FDA has approved 2 kinds of medications for ADHD. So these are number 1, the stimulants, which are the most commonly used ADHD medications. They're common use, they're fast acting, and that's the common one. Number 2 is non-stimulant, which don't work as quickly as stimulants, but their effect can usually last up to 24 hours. Now, medications affect children differently and can have side effects such as decreased appetite or sleep problems. One child may respond well to one medication but not to another medication. So doctors need to try different medications at different doses just to find the right balance between the benefits of taking the medication and the side effects of those medications. Now I have some tips for parents that could help with their child's behavior. Number 1, Create a routine. Try to follow the same schedule every day from wake up time to bedtime. Number two, get organized. Encourage your child to put school bags, clothing, and toys in the same place every day so that they will be less likely to lose them. Number three, learn how to manage distractions. Turn off the TV, limit noise, provide a clean workspace when your child is doing homework. Some children with ADHD will learn well if they're moving or listening to background music. So you got to watch your child to see what works well with them. Number four, limit choices to help your child not feel overwhelmed or overstimulated. You can offer choices with only few options. For example, you can have them choose between this outfit and that outfit. Do you want McDonald's or Burger King? Do you want this toy or that one? Just be clear on that. Number five, be clear when you talk to your child. Let your child know that you are listening by describing what you heard them say. Number six, help your child plan. Break down complicated tasks into simpler, shorter steps. For long tasks, as advised, you start early, you take breaks in between, which will help limit stress. Number seven, use praise reward. Get a chart to list goals, track positive behaviors, and then let your child know that they have done really well by telling them, or you reward them. You reward their efforts in ways. Be sure that the goals are realistic though. Remember, small steps are really important. And number eight, make sure that your discipline is effective. So instead of scolding and yelling and spanking, use effective directions like timeout or removal of privileges as consequences for inappropriate behaviors. And number nine, create positive opportunities. Children with ADHD may find certain situations so stressful, so find out what stresses them and encourage them to do well. Help them create positive experiences. Finally, provide a healthy lifestyle. Give them nutritious food, encourage them to get lots of physical activity, take them outside, and let them get sufficient sleep. So these can help keep the ADHD symptoms from getting worse. So there you have it. That's ADHD in a nutshell. Remember, this video is just for educational purposes and is not to serve as a means to diagnose you or anybody you know that you think has ADHD. If you have any questions, please email me at blessedtalkpsychiatry@gmail.com. Don't forget to go to YouTube, subscribe on my channel, like all the videos. Also go to Facebook and Instagram to get more information. Until next time, let's take care of our mental health. My name is Sachima. I'm going to see you later. Bye-bye.